Hello, everyone. My name is Dr. Fergal Armstrong, and welcome to Cracking Addiction. And today we have with us Dr. Manu Bhatnagar, who's come back to talk to us about ADHD. So, Manu, we've previously discussed, the concepts of prevalence and how ADHD is a neurodevelopmental disorder that has to be present from childhood and it may persist into adulthood. And there's roughly a kind of a 50% persistence rate, if you will. So I thought today we'd talk about how we screen for ADHD, both in children and, given that we are both working in the field of addiction, also how we screen for ADHD in adults. So first of all, if we talk about impulsivity and inattention and hyperkinesis, talk us through those core concepts first.
I might try with inattention
Yeah,
first, because I
all right.
feel like that's definitely going to be the more common presentation, especially
Yeah,
for an adult population. And
yeah,
when we're talking about people who have other disorders and we're questioning whether it could be ADHD, it's usually because the kids who have hyperactivity as a core component get picked up on earlier. But
yeah,
inattention, I think there's a misconception that people think, because of the name ADHD, that those who are effective have a deficiency in attention. And so they just can't
yes,
pay attention to anything. But in fact, you'll find a lot of people who have ADHD can do really, really good work and be hyper focused on a particular thing. And so
yeah,
this is where we can differentiate concentration and attention. So concentration,
mm,
I need to do something. I'm going to spend a couple of hours and I'm going to do it. And I'm going to put the whole world aside and I can do that. That's good concentration. Inattention is you try to do that. I'm going to sit down on my desk and I'm going to study for this exam that's coming up for 2 hours. And you try and you start and you do really well. But then all of a sudden, that YouTube video that you really love to watch has come up again.
like this YouTube video.
This is a prime example of a great thing that would distract someone with ADHD. So you've got, let's think of dopamine and norepinephrine, noradrenaline, as the
Yeah,
currency of the brain. That's what we think is behind ADHD. The inattention, that's a core component of everyone pretty much with ADHD, isn't a lack of that currency. It's not that you're poor of those chemicals. It's more about the fact that your brain just wants to spend that money constantly at whatever it sees in front of it. And so
mm,
it's not the lack of attention, it's that you cannot focus on a particular thing for the amount of time needed to be functional. And so,
yeah. Unless that, unless you are hyper focused. So can we draw out this concept of what is hyper focus? Because for some kids, studying for exams,
yeah.
if they like the subject, could be a manifestation of hyper focus. Yet for anything else,
Yeah.
they'd hate it.
Yep, definitely. And you'll find that some kids, and this can grow on to adults as well, they have a really, really favorite subject. And it's not
Mm,
like I like this subject a little bit more than others. It's that I will drop everything and just focus on this subject.
yes.
And that could be very, very tailored to that
Mm,
person's taste. So it could be maths, it could be
mm,
science, it could be creative, but it
mm,
happens as a priority over everything else.
yeah.
Whereas for unaffected individuals, it can be something that makes them happier, but doesn't come at a compromise for
Yeah.
everything else. So hyperfocus isn't something that is a part of the diagnostic criteria, but definitely you see it clinically.
Mm, yeah. And I suppose for me, that was one of the biggest learning points for me was that you could have inattention and yet be hyper focused and very successful in one particular area of thinking. And so I used to think that if you were if an expert could never have ADHD. That's one of the things that I thought about. What do you say to that?
I would disagree. I feel like there are a lot of people who get very, very good rewards, either tangibly or intangibly, from
Mm,
being successful at their tiny little niche.
right.
Addiction medicine, for example, hypothetically. And
Hmm.
they go all the way through high school, university, and then on further studies because they have the um, social constructs around them that can allow them to flourish. But perhaps if you look at their entire life, they're not able to maintain those functional gains in other things. And if you were able to pick someone up and put them in another area, they might not be able to flourish and academically perform just as well. So I think it is a myth that ADHD results in people being entirely dysfunctional and you cannot succeed because of it.
All right. So we've talked about you. You were kind of talking about the distinction between concentration and attention. I'm still not clear. Can you just
So,
clarify that for me?
so concentration is the ability to sustain focus
Mm,
for a long period of time without any distractions. And
right.
attention is the ability to prioritize something as being worthy of focus.
Right. So salience, really.
That's right. Yeah. So
Right. Right.
that's really derived from your ability to be able to see everything in front of you and pick what's most important based on decisions that are going to have the best outcome for you. And with ADHD, inattention happens because you know that that assignment is due on Friday and you've only got 24 hours to do it. But this other thing that will give you more of a pat on the back, more of a reward intrinsically, just automatically takes over. And that can be
Yeah.
seen as procrastination from the outside. Parents may see their kids as doing absolutely nothing at all, but really
Mm,
they're listening to their favorite music or they're watching something, they're playing a computer game, which they derive more satisfaction from at the cost of something that's more productive.
right.
So
Right.
when that
So,
happens, you're not able to start tasks that are important. So
mm,
you just don't, never get around to it. So that's one of the
mm,
inattentive criteria.
yeah.
And when you do get this burst of energy and say, I'm really going to write that essay or I'm really going to look into that topic, it doesn't fulfill that adrenaline that maybe you first get when you think about doing that task because something else takes over, or it just wasn't as interesting as you initially thought. And so task completion is also an issue. So you'll find a lot of people with ADHD have 10 things that they want to do and they've started all of them, but then they've given up halfway through.
Yeah. Yeah. The inability to complete. That's one for me is one of the diagnostic criteria there. So we've talked about the inattentive symptoms, and I would make the point that I think it's actually more difficult, or rather, children fall through the diagnostic net when they have the predominant inattention subtype of ADHD because they're usually the daydreamers that no one really notices until they start not meeting their full academic potential, perhaps later on, even in high school. Whereas the other type, the other subtype, the hyperkinetic, well, they break the furniture from the age of 2 or 3, don't they? I mean, they're very easily diagnosed. What's your comment on that?
Absolutely. I think the most common symptom of the hyperactive or hyperkinetic subtype is that
Yeah,
of fidgeting. So not being
yeah,
able to sit still, and that could be a very obvious motor symptom of uh, a lot of children
mm,
who are fidgeting with their hands. They always need to have something in their hands to be able to
yeah,
maneuver or break apart or put together. They're always tapping their legs.
yeah,
It's a lot more pronounced than just boredom that could
yeah,
cause fidget. It's disruptive and it's also distressing for them because
mm,
the children affected with hyperactivity really feel that internal sense of agitation about having to get up and do something. So
mm.
expecting them to sit still is actually counterproductive because it just bottles up all of that hyperkinesis until something catastrophic happens later on. And
So there's an explosion of movement.
yeah, yeah, and that
Yeah,
can often be paired with really strong interpersonal conflicts because
mm,
someone is restrained and they're not able to
yeah,
use their physical
yeah,
self to express themselves, and anger becomes a part of that hyperactivity as well if the right
yeah.
circumstances allow.
So where does impulsivity fall into this dichotomous diagnostic construct?
The nature of impulsivity, I think, is in a bit of in the middle of both inattention and hyperkinesis. So a lot of
Yeah.
people will still fit that hyperactivity subset or
Mm,
a mixed type of ADHD, despite not fidgeting, despite not having those overt motor symptoms at the end of the day. One example for impulsivity that's a bit of both of hyperactivity impulsivity is when someone else is having a conversation and someone who has ADHD just interjects in the middle and starts their own
yeah,
conversation.
yeah.
And that's both
Blurts out.
Yeah. That's both a motor reflex of the hyperactivity, but it also demonstrates inattention because the thing that was happening before you spoke, the conversation may not have been
Mm,
interesting enough to attract your attention.
yeah, sure. So we've talked about, how it presents. I think, is there a sex gender issue in the way it presents?
Yeah.
It's in kids versus adults.
In kids, and I think we can probably say across the board, but definitely the studies that have been done in kids would say that
Mm,
it's a 2 to 1 boys to girl ratio.
yeah.
Now, look, this has changed. If you look at the last 20 years, some of our diagnostic criteria, the DSM, for example, has changed how we understand ADHD. For example, in previous iterations of the DSM, having an autistic spectrum disorder precluded you from having an ADHD diagnosis.
Yeah.
It was
Yeah.
thought that inattention and hyperactivity were subsets of ASD, autistic spectrum disorder.
Hmm.
Now we don't believe that. So when it comes to gender, a lot of the studies that have been done about that misattribution were because of ASD being incorporated as a potential neurodivergent illness
Mm.
and accounting for a lot of these boys who have inattention as well.
And what do you think about this idea that maybe girls are more prone to the inattentive subtype rather than boys, and therefore they get diagnosed less frequently?
I think that's, yeah, there's definitely some truth to that, and they've probably evaded a lot of these studies that will call
Mm.
boys 2 to 1 more
Yeah.
effective. Um, and the fact that girls have a lot more relationships with peers that can often mask the inattentive symptoms, or perhaps are in environments where in the past succeeding academically or functionally in the work environment wasn't allowed or in certain cultures isn't expected means that
Mm.
those symptoms aren't as disabling as they can be for boys, and hence the diagnosis isn't made. But definitely we're seeing
Mm.
a lot of young women in their 20s coming out trying to succeed in a corporate environment or in full-time work saying that they're having all of the symptoms of ADHD.
Okay, so we've talked about generally, the way it's thought of. It's a disorder of inattention or impulsivity or hyperactivity. How would you think about it? What tools would you use, or how would you approach the idea of a child in front of you having ADHD? What's your kind of diagnostic pathway? Do you use screening tools? Do you use collateral interviews? What's your approach?
Yeah, look, I think screening tools are really helpful because having a structured way of approaching ADHD is really important when you're talking about a very complex set of symptoms that are very unique to each individual. So having some semblance of objectivity, even though these rating scales can be very subjective, is important to be able to not only achieve a diagnosis but also track progress. And doing them periodically is important to see how treatments are working and how disabling they are. That being said, a lot of the recommendations suggest that screening tools alone aren't good enough to diagnose ADHD, especially with um, teenagers, because there may be very many reasons why a self-report from a teenager can point to a particular diagnosis. For example, as I mentioned, anxiety is very common in the adolescent group and also can account for a lot of inattentive symptoms. So, a young person who's presenting with these symptoms will usually present not of their own volition, but because a school has asked for a review. A parent has been saying, I've been really struggling with this behavior for a while, or someone will notice a really strong deterioration where someone's potential academically isn't being met by their performance. So having that referral source is invaluable and something that we really struggle with for adults because you have that objective secondhand opinion about how someone is in an environment where they're meant to be functional and meant to perform. So taking a history and doing an assessment of the patient is obviously the first and most important thing, but then having some um, collateral information from a parent and a teacher, and then
Yeah.
also a screening tool, I think provides a robust amount of information to be able to reach that diagnosis.
So you've introduced the idea of not meeting academic goals as kind of as a key symptom, especially in children. Let's talk about it from the point of view of a parent. What might a parent say to you that would make you think, yes, this child has got ADHD? What would be the symptoms in the home domain, as it were?
Well, I think the hyperactivity activity, if
Yeah.
that's a subtype that that child presenting with, is going to be the most obvious. And you alluded to it
Mm,
as the destructive nature of a child who is
mm,
hyperactive can lead to broken toys in the bedroom,
mm, mm.
frustration of not being able to complete a task, or
Yeah.
that energy leading to um, anger between siblings or between
Mm,
parents, and also a sense of shame from the child because of multiple attempts to do something they really enjoy, be it sport or joining a new academic pursuit, and wanting to be part of a class, but not being able to fulfill all the requirements. So, starting very many things that might be interesting, either by the child or the parents, getting them introduced to new areas, new concepts, but seeing
yeah.
that they struggle to maintain effort in applying them or persisting with them is
Yeah.
going to always be the most important sign of
Mm,
ADHD. And for a lot of kids, that happens much earlier if there's a hyperactive component.
yeah. I often hear the phrase that sticks in my mind actually is he could do so much more if only he applied himself.
Yeah. Yep. And,
Yeah.
and I think that's important to note because that's also what these kids probably still hear. If they don't have access to mental health supports or a pediatrician,
Mm, yeah.
they don't know that they have ADHD. And so what they're
Mm,
hearing is that they're failing because they're not good enough. And
yeah.
that sense of shame, if it's instilled in you early enough, can
Mm,
really ingrain itself for the rest of your life. And I think we've got pretty good evidence that the way that we're treating kids with ADHD is accounting for all of the comorbid conditions like anxiety and depression and substance use that come along with it. So it's really
yeah.
hard to, undo. You can treat ADHD with a pill. You can't undo years of having undiagnosed ADHD and what that
Yeah.
might do to someone's sense of self.
Yeah. Absolutely. And so we're talking about people who are very vulnerable in a critical neuroplastic growth phase and it's so important to get this diagnosis as accurately and as early as possible. Now you mentioned screening tools. So what is a screening tool and specifically what screening tools might we use
Hmm.
when we've got a child in front of us thinking considering ADHD?
Yeah, and look, this is very different for a child as compared to
Mm,
an adult. And I think the
yeah.
best practice for a child is to use the resources in their school, and use the family's experience of what they're seeing at home versus what the
Mm,
school is seeing. So the gold standard is using um, something like the Connors or
yeah.
Diva, and these are very
Yeah.
well tested and robust
Yeah.
studies, screening tools that have high sensitivity and specificity for ADHD. But
Yeah.
for kids, what's also often best practice is not to just administer this in 1 hour with a pediatrician or a psychiatrist. Best practice would be also to do many other measures of intellectual functioning, including an
Mm,
IQ test and verbal
mm,
literacy, and use a neuropsychologist to
mm,
assess someone for 4 to 6 hours to see, okay, if it isn't ADHD, can we find something else that's accounting for your
yeah.
deficits at school?
Yeah.
And there could be language disorders or
Mm.
spectrum disorder that come as a result of those assessments.
Which goes back to our previous comments in a previous episode, where really the art of the differential diagnosis is absolutely crucial. And you mentioned two words when you were describing the Connors screening test, which was sensitivity and specificity. So, sensitivity means, if it's there, we'll notice it. And specificity means if it's not there, we'll also notice it. We'll know it's not there. So, a valid yes and a valid no, really. But it's absolutely crucial to consider alternative diagnoses in kids. I mean, can you give us a flavor of what else might be causing these? I mean, you've mentioned language disorder. Is there anything else?
I think from a psychiatry point of view,
Hmm.
anxiety is always the number one
Yeah.
differential diagnosis.
And
And
just to be clear, it's perfectly reasonable to make a diagnosis of anxiety in a child who's 5 or 6 years old.
I think when we're talking about the DSM criteria, something like a generalized anxiety disorder, it may not meet that threshold. But when you
Hmm.
think about um, the environment in which a child is attempting to succeed or trying to be functional, the nature of anxiety as a symptom can be so disabling that it looks like
Mm,
inattention. And so
right.
perhaps not the diagnosis of
Mm,
generalized anxiety disorder, although that can happen
mm,
under 10, but parent child attachment and
yeah.
dysfunction in that relationship can lead
Mm,
to symptoms such as anxiety and low mood and fear,
yeah.
which can resemble inattention.
Mm. What other diagnoses might you consider apart from anxiety symptoms and or diagnoses?
Well, I think, and this is where people will have a debate as well currently, but autistic spectrum disorder is
Yeah.
a big one where it's really important to get in early, not just from a treatment and maintenance point of view, but also if you are under the age of 6 years old, having an assessment to say you have autistic spectrum disorder in Australia can derive a lot of supports through funding and resources. And
Mm,
if you have that all set up before the age of 6, then all of schooling can be set up under the assumption that this person needs a lot of extra support. So, assuming someone has ADHD and getting done and dusted with that derives less attention from social services and schools to provide a structured environment. But if you
mm.
look for comorbid diagnoses that could account for inattention or those symptoms, ASD is definitely one that you should not miss.
So really, it's there's actually a moral obligation on the part of diagnosticians, be they doctors or psychologists, to actually get the diagnosis of autism either in or out with the when we're thinking about the co-occurring disorder of ADHD, because, as you say, there is this financial benefit,
Yeah,
which translates into psychosocial interventions, which translates into an altered successful trajectory.
absolutely. And that
Yeah.
degree of self awareness and insight into someone's illness from a very early
Mm.
age can
Yeah.
allow them to be a lot more functional and understand the
Mm.
neurodiversity from early on.
Yeah. We haven't even got to adults yet, Manu, but we have run out of time. I want to thank you for your time and expertise tonight, and I really hope we can speak again very soon. Thank you.
All right. See you soon, Tom.
That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.